All right, so now we're ready for the urinary system. It's a pretty simple system. Every 30 minutes, blood is brought into the kidneys to be filtered. And there are a little over 1 million filtration units called nephrons inside of the kidney that we'll talk about. You'll have to know the parts of a nephron. So you want to make sure that you look through your notes for that. But here's the inside of the kidney. So the renal artery brings blood in. Renal artery is loaded with oxygen, but it's loaded with blood that needs to be filtered. And so it will pass through the pelvis of the kidney, in through the medulla here, and in the cortex where majority of the nephrons are to filter. Once the blood has been filtered, it will eventually pass back through the renal vein into the inferior vena cava, go back to the heart, get recirculated. Meanwhile, the urine and urine's primary components are urea, salts, and water. Urea is formed from the breakdown of proteins. It's a nitrogenous waste. Then the urine will travel down a ureter. So you have 2 ureters. Sometimes kidney stones get stuck in these ureters, terribly painful. And then it will go down to the urinary bladder where urine is stored. And then when your bladder gets full enough, the sphincter, you got 2 sphincters, one you have control over, voluntary, one you don't, involuntary. If that bladder gets to about 300 milliliters, you'll start to feel some pressure. That involuntary probably will relax, and then you got to make sure your external sphincter can hold that urine in. Most people, when they urinate out about 500 mils. The bladder can hold 800 to 1,000 mils, but that's really stretching it. And then the urine will flow out the urethra. That's it for the urinary system.